Have you experienced a significant loss in your life and you're feeling really stuck in your grief? Like you're not making the progress that you believe other people would have who went through a similar experience than you? If you feel stuck in your grief, there may be things that you're doing inadvertently that is making the grief worse. And so today I'm going to teach you some ways that you can stop doing anything to make it worse, which in turn does a lot to make it better. So what are some things that people do sometimes when they're grieving? The stages of grief, as we know from Kubler-Ross model, is denial, which is in the beginning when you're in shock. You can also recycle back into denial in an activity called bargaining, which is when you are trying to, you're stuck in this place of like regret about things you could have done differently or things that maybe you did that you feel like contributed to causing this loss to happen in your life. That's known as bargaining, and that gets you stuck back into the denial phase, which is not where you want to be. Uh, the other stages of grief are sadness and anger. That those are the next stages of grief after denial. But again, grieving is not usually a linear process where you just go from denial, sadness, and anger, and then acceptance. Usually, you bounce around from one stage to the next until you get to a place of acceptance. And even then, you're going to still have moments of sadness that occur maybe for the rest of your life, and that's okay. You can tolerate it. So another thing that people sometimes do that will keep them stuck in grief is, as I said, one of the stages of grief is anger. And when you're grieving, you need to be angry at someone, something, some situation. You've got to get in touch with that anger in a way where you're not turning it on yourself, because a lot of people will not express anger to around them. They will turn it on themselves and blame themselves for the loss, for what they could have done that could have prevented it, what they should have done differently, regrets about maybe not saying goodbye to the person before they lost them. There's a lot of guilt, shame, and remorse that people have after they lose someone. In this case, we're talking about death and dying. It's not unusual for people to go through stages of really kind of having some regrets about the things that happened. That's okay. Of course, you're going to have regrets, but you can also get stuck in those regrets to such an extent that it's like you're picking up a stick and you're just beating yourself with the things that you feel like you should have done differently. That is not productive. Shame, guilt, and remorse, they generally are not effective emotions to hold on to. Shame especially, because shame is just the feeling that there's something about you that's damaged and broken. Shame is an emotion that you want to let go of as quickly as possible, because there is no good that comes from shame in most cases. You know, as it relates to guilt, why do we have guilt? Guilt typically makes us want to go to the other person and try to make it right with them. So guilt serves a function, and that is to take responsibility for something that you did that was a mistake or that hurt someone. So that's the purpose of that. But in terms of remorse, you know, holding on to that and beating yourself up for the choices that you made is not going to serve anyone, and it's definitely not going to serve you. in order for you to really move through that anger, you've got to be willing to let it go. And in this podcast, I teach several ways that you can let things go. But one of the things that I talk about is using your Teflon mind, noticing the feelings of sadness coming up, noticing the thoughts of anger coming up, noticing yourself wanting to beat yourself up. That's okay too. Just notice yourself doing it, but don't get attached to it. Just notice it and let it slip out of your mind, your Teflon mind, and keep it moving. Remember, emotions are chemical reactions in the brain. If we don't do anything to make it worse, they'll last about 90 seconds. So what are you doing to hold on to those feelings for longer? And how is that harming you? And what is that doing for you? If you're not careful, your grief can very much turn into depression because of beating yourself up and for having inappropriate guilt. Inappropriate guilt is actually a symptom of depression. So if you're running it by other people and they're saying, yeah, you didn't do anything wrong, I would look into that. It's possible that you're starting to get depressed. And if you believe that that's true, I would really invite you to watch some of my other videos about depression and what some of the symptoms are, or you can go to your healthcare provider and find out. You could share your concerns with them if you feel like your grief has taken on the form of depression. And after about 6 months of grieving, if you're still not doing well, the 6-month mark, even though it's different for everyone, that 6-month mark is usually what we as clinical psychologists think about in terms of, is this a normal grieving process or is this turned into something more complicated than that? So look into that. And there's also the name of a new disorder that just came out in the DSM-5 TR, the text revision of the DSM-5. And it's called prolonged grief disorder, and it's based on this idea of grief that turns into more of a depressive disorder. So look into that as well. Thanks for tuning in. Thanks for helping to make mental health support free and more accessible. I would really love to hear in the comments what you think about what I shared today and some things that have helped you with your grieving so that other people can learn from you as well. Thanks for tuning in, and I hope that you enjoy the rest of your day.